So I hope I'm audible to each and every one of you. Let's start our session for today. So as I told you, we are going to have a look at a completely new Part C reading. Here we go. Okay. All right. So let's start with the first question. Okay. I need you to pay close attention. Okay. All right. In the first paragraph, how does the writer feel about Julie's difficulties in managing her epilepsy? So all of you read the question. The question is from the first para, and what do we need to figure out? Look at the question word. What do we need to figure out here? It's a complete question. What do we need to figure out? Can I get some answers? Yeah. Maria, Silna, Asha, Jismi, Ajinya, Tindu, Silna. I'm talking to each and every one of you. Can I get some answer? I want you guys to read the question and tell me what do we need to find out here. Yes.
Writer's feeling.
Writer's feeling. Writer's feeling about what, Silna? Writer's feeling about?
Difficulties in managing her.
Feeling about Julie's difficulty. So Julie, we will be looking at someone named Julie, and we need to figure out how does the writer feel about Julie's difficulties in managing her epilepsy. So we need to figure out the writer's feeling. I need your complete attention. Okay, we need to read the first para, and we will learn about Julie's difficulties, and we need to figure out how does the writer feel. Okay. All right, all of you get ready. Here you go. This is your first paragraph. Go through the heading, go through the first para. You have 55 seconds. Okay, I need you to pay close attention. Let me read the first paragraph. Remember, we need to figure out how the writer feels about Julie's difficulties, right? Okay, all right. So 1 second. Okay, so let's start. So today's topic is wearable digital health technology for epilepsy. So it's a wearable, a digital health technology that can be worn, and it is for epilepsy. So this is not my personal material. This is written by some medical professionals. So it's about wearable digital health technology for epilepsy. Let's start with the first paragraph. Sam, a 17-year-old with juvenile myoclonic epilepsy experiences. So they start with Sam. Sam is someone who is 17 years old and who has myoclonic epilepsy, and he experiences weekly myoclonic seizures and 2 generalized tonic-clonic seizures annually. And seizures are often triggered by poor sleep or missed medication. So they start with someone named Sam who has myoclonic epilepsy, who experience seizures weekly and 2 generalized tonic-clonic seizures every year. And his seizures are triggered by lack of sleep and by missing his medication. To help him manage his condition, in order for him to take care of his condition, his parents encouraged him to use a wrist-worn seizure detector. So he wore a digital seizure detector in order to, take care of his condition. One night after Sam went to bed alone, the device alerted his parents at 4 a.m. to a seizure. They found Sam unconscious, realizing the device's importance in preventing potential death. Okay, they now, what happened? They bought him a wrist-worn seizure detector, and one night the detector alerted them when Sam was alone that, and they found him unconscious because of a seizure, and they realized how important this detector was in saving his life. And they now face the challenge of balancing Sam's independence with ensuring his safety during convulsive seizures. So they have a problem now. Sam's family has a problem. Sam's family are facing a problem now where they have to ensure Sam is independent. At the same time, they have to ensure his safety. How can they encourage Sam's independence yet keep him safe with his convulsive seizures? So this question, how can Sam's family encourage his independence yet keep him safe with his seizures? Who is asking this question? Can I get some answers here? Who is asking this question? Yes? Writer. So writer describe Sam's situation, then the writer is asking us a question. Writer is asking us, how can his parents encourage Sam to be independent, at the same time keep him safe? Okay, so that was Sam's story. Our question was about Julie, right? So let's move on. Okay, Julie, a 35-year-old woman living alone with epilepsy. So we have another patient named Julie who is 35 years old, and she lives alone and she has epilepsy, and she has experienced good seizure control with good seizure control with carbamazepine until recently. Okay, if I'm pronouncing the name of the medication wrong, bear with me. So Julie has, Julie has been able to control her seizure very well using the medication until recently. What happened recently when her partner noticed episodes of unresponsiveness with hand automatism of which she was unaware, and recently her partner noticed that she's experiencing episodes of unresponsiveness, and her hands are moving automatically, and she's unaware of all these things. Julie's medical team is considering additional medication, but they struggle to assess her response without quantifying her non-convulsive seizures. Okay, take a second, read that. Okay, so now since Julie is having episodes of unresponsiveness with hand automatisms which she's not aware of, her medical team is thinking about giving her extra medication, but they are struggling to assess her response without measuring her non-convulsive seizures. So her medical team, they cannot, they are unable to assess her response with not being able to measure her seizures. So her medical team are exploring whether a wearable digital health device could help. So that option is being explored by Julie's medical team. Okay, all of you are with me so far? Can I get some answers? So far clear?
Yes, ma'am.
Okay, others? Are you with me?
Yes, ma'am.
Okay.
Yes,
Now comes, could a wearable digital health device help Julie track her seizures and improve treatment decisions? So all of you take a second. Could a wearable digital device help Julie keep monitoring her seizures and improve treatment decisions? Who is asking this question?
Writer, ma'am.
Writer, very good. Writer is asking us this question. Okay, so this is a question put forth by the writer, right? Now, in the article, they talk about Sam. They describe how his situation is, how his parents are struggling to maintain his safety and ensure his independence. Then they talk about Julie, how she is someone who lives alone with epilepsy. She was able to control her seizures with the medications, but recently her partner has noticed some symptoms, and her team is thinking about giving her some extra medication, but they are struggling to assess her seizures, and they are investigating whether a digital device would help. Then writer is asking this question: could a wearable digital health device help Julie track her seizures and improve treatment decisions? What do you think? So what do you think? What feeling is the writer being angry at Julie's situation?
No time.
No. Is he annoyed? No, right?
No.
Not annoyed, not irritated, but rather the writer is asking, could a digital health device help? Doubt? No, take a second. So that brings me to asking a question using could. Okay, so could usually recommend. Remember, could usually represent. So it's when I'm talking to you and you're saying, ma'am, it's very difficult for me to manage OET writing. I'm practicing every day, still I'm not seeing any improvement. And I'm like, okay, could a extra session with your writing teacher help? When I say it like that, what am I doing there? Am I being annoyed with Silna? Am I being frustrated? Or when I ask her, could an extra session with your writing teacher help? What am I doing? That is a question. Yes, Balvinder?
Assistance, ma'am.
But what am I doing? Yes, I'm asking if you could extra help from your teacher help. But what am I doing there? What feeling? What am I doing there? Am I being understandable of a situation? Yes. Okay, I'm understanding. And when I'm asking that question, what am I doing there? Could some extra help from your writing teacher help? What does that mean?
Ma'am, you are giving hope.
Almost there. What is it? What is it? I am suggesting, I'm making a recommendation. She asked my opinion and I'm making a recommendation. Could it help? Do you think, having an extra class with your writing teacher every week, could it help? I am making a recommendation. Okay, I'm being empathetic, I'm being understanding, and I'm not, rejecting, or I'm not being dismissive of her problem. Rather, I'm being understanding. I understand what she's going through, and I'm making a recommendation. Now, are you clear? So yes, Balvinda, you're almost correct. It's a hope thing, but how am I giving her hope? I'm making a recommendation on what she can do. Are you clear now?
Yes, ma'am.
Good. So when you say, could this help? Could this particular thing help? You're making a recommendation. Are you clear now?
Yes, sir.
Okay. So here, what is the writer doing after describing Julie's situation? What her medical team is trying to achieve? And he's saying, the writers are saying, could a wearable digital device help Julie track her seizures and improve treatment decisions? Okay. Now let's have a look at our options. The writer feels irritated with Julie for not managing her seizures more effectively. What do you think? Is it correct?
No,
No,
ma'am.
No, of course not. The writer is not irritated. Okay, next one. The writer shows sympathy for Julie's challenges by recommending digital health device for seizure monitoring.
Can be.
Can it be? Let's see. The writer believes Julie should completely discontinue her medication and focus on lifestyle adjustments. What do you think?
No.
The writer is unconcerned about Julie's condition and does not offer any solutions. Actually, the writer offers a solution, right? So here, B is the answer. So in order for you to understand this answer, you need to make sure that you notice the question. After describing the situation, that's why I asked you, who is asking the question? The writer. So that's where you get the writer's feeling. Okay, pretty straightforward. Next one. The writer suggests in the second paragraph that a significant concern for people living with epilepsy is. So from the second paragraph, as suggested by the writer, what do we need to find out? You guys tell me. Significant concern, relevant concern for who?
For people living with epilepsy.
People living with epilepsy. So people who have epilepsy, a significant concern for them. What is that? What is it? Okay, epilepsy. Okay, significant concern for people living with epilepsy. So concern. What do you mean by so concern? Can be a worry, something that is a problem, something that is an issue, right? Okay, is it a good thing? Yeah, one second.
No,
concern. Is it a good thing? No. Yeah. Balvinda, what were you saying?
Concern means worries about. You told us.
Yeah, worries about something. Yeah, about something. About means, when you're about the topic, before you say the topic, concern about what topic, okay? So here, significant concern, significant worry, it is something, some issues that they are facing, some challenges, some difficulties, all these are concerns, okay? All right. Now, let's have a look at the second para. We have two questions from here. I want all of you to go through the paragraphs, okay? Paragraphs are pretty long, but they are easily understandable. Take 55 seconds, go through the para. Okay, let's read it. I need your complete attention on the screen. For people living with epilepsy, for people who have epilepsy, as well as their families and caregivers. So for people who suffer from epilepsy and their families and their caregivers, epilepsy is an unpredictable, challenging, and often frightening disorder, especially for the 1/3 of people with epilepsy who have ongoing seizures despite medical treatment. So what is the one problem? That epilepsy is unpredictable, it's challenging, and it is actually scary. And especially for people who have ongoing seizures, even though they are receiving medical treatment. The paroxysmal nature of Sam's seizures makes it difficult for his parents to allow him usual independence of a teenager. So what is the nature of Sam's seizures? It's paroxysmal nature. Is making it difficult for his parents to allow him to enjoy the independence, freedom of a teenager. So again, another problem. Okay, so we need to understand paroxysmal nature. What does that mean? Let's see what does that mean in the following sentences. They fear he will have a seizure when no one is around to keep him safe. These are valid. Okay, so what do you think paroxysmal nature is? Is it, what do you think that means? Okay, when you say
type of night,
is it night? Is it night? Does it mean it happens at night? Is that what it means? That is nocturnal, right? What do you mean by paroxysmal? Does the this particular seizures, does it happen at a specific time? Do they know the time beforehand?
No.
So that's why they said is paroxysmal nature of his seizures are making it difficult for his parents to allow him the freedom of a teenager, because they fear he will have a seizure when nobody is around. Okay, so it's not about nobody is around to keep it. So which means will they know when the seizure is happening? Which means they don't know. It can happen anytime, right? It can happen anytime, and they are worried if somebody is not there with him, what about his safety? So it can happen anytime without warning. Okay, so when something is paroxysmal in nature, it can mean, so they are worried that it can have he will have a seizure when nobody is around to keep him safe. So which means if they know when if they knew, or if they are aware, or if they had any knowledge about when it can happen, they can be there with him. But they are afraid it can happen anytime when they are not with him. So that means they don't know they don't know when it will be. So there is they cannot predict. They don't know when it can happen, which means it can happen anytime without any warning. So the paroxysmal nature is making them afraid. It is making it difficult for them to give Sam all the freedom he needs as a teenager. Are you clear so far?
Yes.
Okay, so they have said the paroxysmal nature is making it difficult, and they have clarified it. They are afraid that the seizure will happen when they are not around, which means they don't know when it will happen. So it can happen anytime. So that's what is making them afraid. Now, these fears are valid. Seizure-related injuries and accidents are most often associated with generalized tonic-clonic seizures, and up to 25% of people with such seizures have had at least one severe injury in their lifetime. So another problem with seizures, what is another problem? Another issue, seizure-related injuries and accidents. They are usually associated with this type of seizures, generalized tonic-clonic seizures, and up to 25% of people with generalized tonic-clonic seizures, they have had at least one injury in their lifetime. Furthermore, generalized tonic-clonic seizures are the strongest risk factor for unexpected death in epilepsy, the leading cause of epilepsy-related death. And when it comes to a risk of death, which type of seizures have the strongest risk of death? Generalized tonic-clonic. So what is another problem with epilepsy? That, another concern, another important concern, what is it? The sudden unexpected death. Next one. The average risk of sudden unexpected death for a person living with epilepsy is 1 person per decade. So the risk is every 10 years, 1 person. That's the risk. Okay, thus each year, sudden unexpected death claims 1 in 1,000 lives among people with epilepsy. The risk is 1 in 250 for those with severe forms of epilepsy. So annually, the risk is how many people die, how many people can die because of this? 1 in 1,000 people. And if anybody has, among people with severe epilepsy, 1 in 250. That is the rate of death. The risk of death increases with frequency of generalized tonic-clonic seizures, but can be modified by living conditions. So the risk of death increases with this type of seizures, but we can modify that risk using through our living conditions. Living alone or sharing a household, but not a bedroom, associated with an increased risk of sudden death. So somebody who lives alone, or if they are sharing a household, but they don't share a room with anyone, that means they are alone when something like this happens, that can increase the risk of sudden death. A person who sleeps alone and has frequent tonic-clonic seizures has the highest risk. Okay, so we have 4 problems. What is it? Epilepsy is unpredictable. It is very scary, and its paroxysmal nature makes it difficult for people to enjoy freedom. And we can also get injuries and accidents. Injuries can happen, accidents can happen, and unexpected death. All of you go through that.
Okay.
The paragraphs are straightforward, right? And remember, paroxysmal nature, they say the unpredictable and it's frightening. Then they say the paroxysmal nature of Sam's seizure makes it difficult for his parents to give him freedom because they are afraid he will have a seizure when nobody is around to keep him safe, which means if they knew when the seizure will happen, they can be with him. But it can happen even when they are not around, which means it can happen anytime. So paroxysmal nature is something that happens anytime without warning. All of you go through that. And actually, this paroxysmal thing, we have done another material where we had to deal with the same vocabulary. So make sure to go through that. Make sure to understand the meaning here. So let's have a look at the question. Okay, options. Okay, get ready. The writer suggests that a significant concern for people living with epilepsy is the erratic nature of seizures and the risk of serious injury or sudden death. What do you mean by erratic nature?
Ma'am, not equal pattern.
Yes, correct. Not equal pattern. So which means, when there is a pattern, so yeah, when there is a pattern, we can predict it. So when there is no equal pattern, it is
Unpredictable.
Unpredictable. Okay, so erratic nature. Can this be our answer?
Can be, ma'am.
Can it be? Let's see the other options. The writer suggests in the second paragraph that a significant concern for people living with epilepsy is the high cost of medical treatments and medication for epilepsy patients. Did they talk about the cost of treatments?
No, ma'am.
No. The writer suggests in the second paragraph that a significant concern for people living with epilepsy is the emotional and mental strain caused by social stigma during epilepsy, surrounding epilepsy.
No, ma'am.
No. Social stigma.
Shame, ma'am.
Yeah, shame. Public, the shame that we have, the public disapproval and shame. Okay, public disapproval, social disapproval, and shame. That's what we call as social stigma. Very important vocabulary. So they have not mentioned anything of that sort in the para. Next one, the writer suggests in the second paragraph that a significant concern for people living with epilepsy is the difficulty in finding appropriate caregivers for people with epilepsy. Is that it?
No, ma'am. No, ma'am.
No, ma'am.
So our answer is option
A, ma'am.
Erratic. Be very careful. Erratic nature. It does not mean filled with errors. It means erratic. As Balwinder told us, there is no pattern. When there is no pattern, we are unable to predict it. Okay. All right. Now, next question from the same para. What does the paroxysmal nature of epilepsy refer to? So let's read. Okay. Okay. Take a second, quick second. Go through the sentences about that vocabulary. Okay. Now, the constant and regular occurrence of seizures at predictable times. What do you think?
No, ma'am. No, ma'am.
The abrupt and irregular onset of seizures that vary in severity and frequency. What do you mean by abrupt?
Abrupt means, ma'am, suddenly.
Sudden. When something is abrupt. Look at that word sudden. Okay.
Can be,
sudden, or wait a second. We can also say without any. It happens without any warning. Irregular onset of seizures that vary, that differ in severity and frequency. What do you think?
Can be, ma'am.
It can be, right? Let's see. Let's have a look at the next one. The complete absence of seizures after a long period of control. Is that what it means? No.
No.
The gradual and steady increase in the frequency of seizures over time. No, not over time. That is, it says so.
No.
Remember, I've told you before, when there is a vocabulary question, read the sentence above the vocabulary, the sentence with the vocabulary, and sentence after it. So they say that Sam's parents are afraid of paroxysmal nature, that in the next sentence you get your answer. They are afraid it can happen when they are not around, which means they cannot, if they knew when it will happen, they will be around, right? So they are afraid it can happen anytime when they are not around. So which means paroxysmal nature is that it can happen anytime without warning, sudden, irregular onset. Okay. Are you clear? Any doubt so far?
Yes, ma'am.
Okay.
No, ma'am.
All right. Which brings me to, yes.
Steady means slowly.
Steady is slowly. Yeah, steady. Constant rise, a steady, slow rise. Yeah.
Okay.
Slow but steady means it is increasing at an equal, slow and equal rise. That's what it means. Slow and equal.
Okay.
All right. No variations in between. The rise is so today 2%, tomorrow also 2%, day after tomorrow also 3%, 2%. So that is the steady rise, equal and slow. Okay. That would be an appropriate definition. Okay. The challenges in detecting seizures mentioned in the third paragraph can result in. So what do we need to find out? So we have challenges in detecting seizures, and those challenges are mentioned in third para. And what do we need to figure out about those challenges? What do we need to figure out?
Result, ma'am.
Result in. Yes, whenever you have a question ending in result in, we need to figure out the result of what was mentioned before. So here they have mentioned the challenges. So we need to figure out the result of the challenges. Challenges means difficulties in
detecting, identifying, diagnosing
seizures. Okay. So when it comes to detecting seizures, there are challenges, and what is the result of those challenges? Okay. Okay. All of you get ready. Go through the third paragraph. Pretty small paragraph. Go through it. Okay, let's have a look here. I need your complete attention on the screen. Julie, remember Julie, the first paragraph, they had mentioned that patient. So Julie faces two challenges that Sam doesn't. So Julie faces two problems that Sam does not face it. That is living alone and having subtle, undetectable detected seizures. So her problem is she lives alone and she has subtle, undetected seizures. That's the two problems that she faces. These seizures lack clear physiological markers, making detection difficult, even for convulsive seizures, especially if they occur during sleep or cause amnesia. So what is the problem that Julie faces that Sam doesn't? That Julie lives alone and her seizures are subtle and it goes undetected. Subtle means, is it evident? Is it clearly evident? No,
unevident.
Not evident, not clearly evident. It happens, it's very subtle. Okay, so that's the two problems that she is facing, and her these whatever seizures that she experiences, those seizures they don't have any physiological markers, so that makes it difficult to detect. And even if she experiences convulsive seizures, especially those seizures occur while she's asleep, or if it causes amnesia, then detection becomes difficult. Seizure reports are often unreliable, with over half of seizures and 85% of nocturnal ones going unrecorded. So seizure reporting of seizures, it's not always reliable. And more than half of seizures and at least 85% of nocturnal ones are the ones that happens at night, these go unrecorded. We don't get to document it. Okay. Now, challenges with seizure recognition. So remember our topic, challenges with seizure recognition. So when there are difficulties in recognizing seizures, it can lead to diagnostic delays, inaccurate diagnosis, and inaccurate classification of epilepsy and seizure, and under and over treatment of underlying disorders. So what is the result of challenges in seizure recognition? What is the result of that? It can lead to delay in diagnosis, or the diagnosis can be inaccurate and classification can be inaccurate, and under and over treatment of underlying disorders. Okay, so what happens? Diagnosis becomes delayed, inaccurate diagnosis and classification of epilepsy and seizures, and under and over treatment of underlying disorders. So this is the result. Okay, contribute to means lead to, or another word for result in. Got it?
Yes, ma'am.
Okay. Undiagnosed seizures can endanger the person. So if the seizures are undiagnosed, it can put the person at risk, especially in activities such as driving or working. While overdiagnosis can lead to unnecessary treatments and restrictions, reducing quality of life. So the writers have told us if the seizures go undetected, it can put the person at risk, especially if they are driving or working, or if there is overdiagnosis, it can cause unwanted treatments and restrictions which will affect the quality of the person's life. So our answer is this sentence. All of you go through that. Okay, so we need to figure out the option that matches with this one. Okay, let's see. The challenges of detecting seizures mentioned in the third paragraph can result in postponements in diagnosis, inaccurate classification, and under or over treatment. What do you think?
No, ma'am. Postpone it.
Okay. So wait a second, I'll tell you. I need to tell you something, but yeah, wait a second. The challenge in detecting seizures mentioned in the third paragraph can result in delayed diagnosis, misclassification, and inappropriate medical intervention. What do you think?
No, ma'am.
So the diagnosis can be delayed, classification can be wrong, but does it lead to wrong medical treatment? What do you think?
No,
Did they say
no,
that wrong medical treatment?
No.
So B, not the answer. The first two are correct, but not the last one. Next one. The challenges in detecting seizures mentioned in the third para can result in delays in diagnosis, okay. Incorrect categorization, classification can be incorrect. Either inadequate or excessive treatment. What do you think? Maybe. Let's see. The challenges in detecting seizures mentioned in the third para can result in delays in seizure recognition, incorrect diagnosis, and unnecessary treatments.
No, ma'am.
No, not that. Okay. No. Which one matches it? Which one, A or C?
C, ma'am.
C is the answer. So you may feel A is the answer, but delay is a naturally things get delayed. Okay, so it has a natural tone to it. When you say postponement, somebody is delaying, somebody is causing the delay. So you may think A is the answer, but remember, postponement is when some person causes the delay, or some factor deliberately causes the delay. That's when we say postponement. So that is why A is not the answer. Somebody is causing the delay. Okay, now wait a second. You may feel like B is the answer, but medical intervention, what did they say? Under or over treatment. Under treatment means inadequate. Over means too much, right? Right? Yeah.
Yes, ma'am.
So that's why here it is inappropriate treatment, not under and over. Unsuitable treatment, that's not mentioned. So the closest one is the closest and detailed one is C. Okay, are you clear? So here
Yes,
they have
ma'am.
just written unnecessary treatments. No, inadequate or too much. Both should be there. So D is kind of, we feel like the answer, but compared to D, what is the best one? C is the
C
best
is the
one.
best.
Remember, among all the option, which is the best? That's what you need to write. Okay. So you may feel like, ma'am, they have mentioned excessive treatment, so that means unnecessary treatment. But compare D to C, which is better? C is better. Silna, Lydia, Balvinder, Asha, Meenu, Ajnia, Tindu, Jismi, Maria. Without confusing you, have I conveyed myself clearly?
Yes, ma'am. Clear.
Okay, so you may feel like A is the answer, but remember, postponement, yeah, it means delay, but when it comes to postponement, it is something that happens. It is something that somebody does it. Somebody postpones. Some factor or someone postpones. Someone causes the delay. But here, delayed diagnosis, delay can be natural. So that is why A is not the answer. Okay, now B is not the answer because of the word inappropriate. Excessive and inadequate is different to inappropriate. D is not the answer because compared to C, when you compare D and C, which is detailed and which is exactly what's given, that is C. Okay, be very careful. Okay, you may feel like all the options are similar. You need to be very careful. Okay, all right.